For this position, we've traditionally suggested that at the most extended position of the crank, you put your heel on the pedal. On this one, we might be just a little bit closer. It'll help increase a person's ability to, we'd say, couple with the device and maintain their position. I think the other thing is the torso is clearly out of the way, so it's okay if they have a little more knee flexion and they're not being inhibited by the edge of the bed or the edge of the chair. So for this one, for this position, like I said, maybe we get the heel to the pedal in our most extended position with, let's do this on the other side. Let's put heel on pedal at our most extended position. You see that the leg is fully extended. So maybe we bring it just a little bit closer. And then, so we'd have the person scoot down since you're on the keeper, if you will. And then in that situation where the heel's on the pedal, we'd have just a slight knee bend. And when we do that, that allows the person to stay a little more connected with the device, a little bit easier. Again, getting a person to do something is better than nothing. And so if they can sit and pedal, that's great. Sometimes the secondary benefit of this type of position is a little bit of elevation for the legs. And so not only are you getting muscle contraction, but you're getting a little bit of elevation. That can be a benefit and a challenge, if you will, because that requires a lot of hip flexor work through this position. Now, sometimes people may not have good tolerance of this because it does require low ab and hip flexor strength to do some of the activity. So you may find that a person can only pedal for a minute, then they have to take a rest. But great, that's something. Something is better than nothing. So maybe they take a rest, maybe they do another bout, which is just fine.
Well, in so many health conditions where there are so many benefits to exercising horizontally, POTS and all kinds of things, right? So this is a great way, whether you're in a bed, on a table, to lie down comfortably and just cycle. Right. And for the sake of the PT table, we have this set higher. If you can get where you can set up against your back up against a wall and sit up, it gives you more range. One of the things that I find in this position is even simply, if you're doing calf raises, right, and getting the blood circulating. I know that for me, like having this in a hospital bed, post-injury, would have likely helped me prevent getting a blood clot, for example. Absolutely. So is getting people to exercise while they're lying down, while they're bedridden, and really helps with outcome.
Absolutely, yeah.
So one of the things that we like is I can put some focus on my core here, right? Just engaging it, pushing my belly button to the table, keeping my hips straight, and really just focus on trying to, move it, get everything incorporated.
Well, in order to do this well, you do have to stabilize the trunk. And so the trunk does need to be engaged in order to pedal this well without shifting all over the place. Yeah.
And so one of the things that we've done with this new version, is we've made the bar wider. And in bed situations or tables, the reason that we did that is that they're cushiony. Right? There's a cushion layer. And so by making it wider, we're okay if it moves a little. Right? But just it makes it so much more stable.
This is not uncommon, say if you're just using a regular bike, because a regular bike can be tippy if you're irregularly pressuring it. So at some level, whether it's this or a regular bicycle, you do have to find economy of movement, of motion, of creating torque to a system without making it unstable.